Rescue 917. You're dispatched to 1455 Crest Avenue on a fall with a head injury on a 62-year-old male. Timeout 1405. Be advised you have a bystander on the scene who is an off-duty nurse.
Okay. BSI, is my scene safe?
Yes, your scene is safe.
Alright. Do I have any hazards at the scene?
No hazards at this time.
Alright. Is this the environment outside? You said it was 2 o'clock in the afternoon, so it's going to be a hot day. So I know my patient's probably going to be hot and probably a little hotter than the outside temperature. I don't think I need any additional resources at this time. I think me and my partner can handle the call along with the off-duty nurses on the scene. So my mechanism of injury is that this was a fall with a head injury. Sir, can you hear me, sir, and tell me what happened, sir?
Yes, I can. I was going to get my mail from the mailbox,
Mm-hmm.
and the dogs of my neighbor came across and got me tangled up in my feet, and I fell and hurt my head.
All right, sir, you're not complaining of any, that's not tender or anything. You're not having any neck pain or back pain?
No.
Okay, so at this time, I see no reason for us to take C-spine precautions. I see no reason to take C-spine precautions. So he is alert to verbal and stuff. He was able to communicate with me. That also tells me that his airway is intact, and I see no injuries to his airway. So now we're going to move down to his breathing and stuff. We're going to inspect his chest. We're going to look at his chest to see if we see any injuries. We don't. We're going to palpate his chest, and there's nothing there. So now we're going to listen to breath sounds. His breath sounds are clear bilateral. So at this time, we're going to put him on a little oxygen, give him some oxygen on a non-rebreather mask at 15 liters per minute. I'm going to assess his skin. His skin is a little pale. It's warm and kind of sweaty. Going to check his pulse. His pulse is good. The quality's good. The rate's good. So he's got a radial pulse. That means he's got at least a systolic blood pressure of 90. So he was able to communicate with me. He knows where he's at. He knows what has happened. So that's going to give me a GCS score of 15. We're going to check his eyes, check his pupils, make sure they're active. They are. Based on the information I found, just due to the fact of that he's got a head injury and he's fallen, and he has this major bleeding which is being controlled at this time with direct pressure, I consider him a load and go. So we're going to get him in the back of the ambulance. So now we're in the back of the ambulance. So sir, tell me exactly again what happened. You said that you were going to get some mail and the dogs tripped you up. Is that what you said, sir?
Yes.
Okay, so you didn't lose consciousness or nothing. Okay. So let me get a little bit of history from you, sir. So the signs and symptoms are that you've fallen and you got a head injury. Yeah, are you allergic to any type of medication, sir?
No.
Okay, what type of medications do you take?
Celebrex for arthritis and blood pressure pill.
Okay, so your past medical history is that you have high blood pressure and some arthritis. Do you have any other type of medical history, any type of cardiac or anything like that? Okay, and did you have lunch today, sir?
Yes, I did.
Okay, and your visit leading up to this was you were just going to get your mail and that was it?
Yes.
Okay. So the onset was that he was going to go get his mail. Does anything make it worse?
No.
Okay, so just hurts. Okay. So the pain's not radiating nowhere.
No.
Okay. Severity on a scale of 1 to 10, 1 being hardly no pain at all, 10 being unbearable pain. What would you rate your pain at, sir?
7.
At a 7 right now. Okay. And what time would you say this happened? What time would you say you fell exactly?
About 2 o'clock.
Okay. So you fell about 2 o'clock. Okay. So I'm gonna go ahead and get some vitals. I'm gonna go ahead and get a blood pressure, a pulse, a respiration, and a sat, please.
Okay, blood pressure is 140 over 78.
Mhm.
Pulse is 72. Respirations are 14.
Okay.
The SPO is 100%, and his pain is a 7 out of 10.
All right. So we've got all that taken care of. So now that we've got any of that taken care of, now I'm going to start my detailed physical secondary assessment. I'm going to check the back of his hand, make sure that the bandage is still good from where we bandaged him up and when we got in the truck. It's still good and everything looks still good back there. It's not bleeding. So we're going to check the skull for any deformities or anything like that. See if we see any vital signs, which we don't. We're going to come on down. We're going to check his cheeks and everything and his jaws, make sure they're okay. We're going to reassess his pupils, make sure they're pearl, which means pupils are equal, reactive, and round to light, which they are. We would check his mouth, make sure he hadn't lost no teeth or nothing, which he hadn't. We're going to check his neck and his cervical spine back here. Is that hurt or anything, sir?
No.
All right, we're going to check the neck, make sure the trachea is midline, there's no JVD, which there's not. We're going to check the chest. We're going to palpate the chest, inspect the chest, and look for any injuries. And if he was real severe stuff, we would completely unclothe him. But since it's just a localized injury, I see no reason to totally unclothe our patient. We're going to inspect his abdomen, palpate each quadrant of the abdomen for any teardness, rigidity, and stuff, which I see none. We're going to check his pelvic, make sure it's stable, which it is. If need to be, we would assess his genital area. We're going to check his femur bones and his tib field for any deformities or contusions or braziers, which there's not. Sir, can you push down on my hand? Okay. Can you feel that, sir?
Yes, I can.
Okay, he's got good PMS in his right side. So we come and check his left side, check his left femur, check his tib field down here. Sir, can you push down on my feet? Okay. Sir, can you feel that?
Yes, I can.
All right, he's got good PMS in his left side. We'll come over here and check his upper extremities. Sir, do you have any pain up in here?
No.
All right, sir, can you squeeze my hand? Okay. Can you feel that?
Yes, I can.
All right, and he's got a pulse in his extremity. All right, what about over here? Can you feel this?
Yes,
Any
I can.
pain over there?
No.
That? Okay. Can you squeeze my hand? All right, can you feel that?
Yes.
He's got good PMS in his left side. We're going to check his back and everything. Any tenderness, any hurt, or anything like that back
No.
in here? All right, so his back is good and everything. Based on all this information I found, I'm still good with transporting the patient to his hospital of his choice, sir. What hospital did you want to go to again, sir?
St. Vincent's downtown.
All right, I'm still good with us going to St. Vincent's downtown. I don't see no reasons for us to go to UAB and trauma lord him. At this time, I'm going to place him on a monitor, place him on an EKG monitor. And so we're going to go ahead and start an IV on you, sir, and get you some fluids in you, replenish some fluids, sir.